Very good evening to you, and thank you so much for joining us, Ms. Serobe. Let's first start with the importance of the payment of this tranche to the Covax program, especially given the uproar, furore around claims that we hadn't made a payment.
Well, the payment is only due 15th of December, so let's just kill that thing about the deadlines. The deadlines is 15th of December. And secondly, the deposit, this is a program working together with the Department of Health and Department of Treasury and the Solidarity Fund to make sure that they can make this deposit at the required time. And it is 327 million rands, as you said, 15% of the total. And that is covering 10% of the population, about 6 million people. And so there's nothing about the missed deadlines and all that kind of thing. The deadline is 15th of December.
And perhaps to help South Africans understand a little bit more about Covax, we've been talking about the platform for a bit, but we haven't really spoken about the relationship in terms of, from a government's perspective and the fund's perspective, how that's going to be facilitated, including opportunities for facilitating local vaccine manufacturing. Do those enter the discussion?
Well, remember that the fund, its job is to augment the work of government. So the pandemic is a program of government. The crisis is a crisis of government. And so we fit in and be catalysts where we are needed. And so in our discussions with NDOH, we always look for where exactly are we able to intervene, where we are needed to do so. And so this particular program, this Covax program, was a typical point of that, where the fund was only too happy to be able to be a catalyst for that and intervene at the right time to make sure that we can get the vaccines and when they are ready as per the requirement of the government, as I said, the 10% of the population. As for the local production, it's a very complicated topic, this one about the vaccines. We are always going to be guided by the Department of Health as to where they take that to. At this moment, they wanted to participate in this Covax program, and that's exactly where we have taken them to. Mm-hmm. And this deposit is meant to make sure that government is in a position to, we are donating the money for government to be able to put that deposit, like most other countries, to get their required 10% of the vaccines.
But that no doubt comes with also planning and, as you say, having discussions about the needs of the country, capacitating the country, including guidelines on the distribution and equitable access of the vaccine. We mentioned the 10% of the population that it will serve, but we still don't know much about the storage conditions of the vaccine that will end up, being a party to, the dosage and the frequency thereof. Is there a framework, at least, that's in place for the fund on how to facilitate some of these questions that may arise?
I guess the main thing about why government looked at Covax, at least as I understand it, is that they have a choice of 9 of those, and not 1. So if you are in the Covax program, you have the high probability of being with the right one, because there's 9 of those types of vaccines. It does not mean they don't have bilateral discussions of their own with others, but all the intellectual capacity for this particular kind of program is sitting with the government, specifically Department of Health. Of course, they are working with private sector and all the health specialists in the country, but I think we can do better also as the country to just listen carefully to where they are guiding us to, because it is a complicated program. And so our comfort as a Solidarity Fund was that they have studied this quite well, and they have decided that they will take 10% and cover the 10% of the country through this Covax program with Gavi. And their deadline is 15th of December, and that is what we facilitated. Our donation was meant to make sure that they meet that kind of deadline.
So let's just quickly look at the report that was given earlier on. As I mentioned, it was 6 months since the inception of the fund. You've so far received 3.1 billion rand financial donations. Where has that money gone to largely?
Largely because the first phase of the pandemic was all about the health issues, the ventilators, the high care equipment, the PPEs, the testing. So the bulk of the money, 70 to 75%, actually went that route, and the balance went to what we call the humanitarian issues that came out of, for example, the lockdown, came the food crisis, came the gender-based violence. We've pretty much put money into those kinds of programs quite extensively. In fact, on the food crisis, I may just stress that we started off with the food parcels not being comfortable either that food parcels are sustainable, but we have moved to food production now. That is the latest program, and we're concentrating in the rural areas, mainly under the traditional leaders, over 882 of them. And that covers about 20 million South Africans in the rural areas who don't have access to farming inputs, farming vouchers, and that is where we're going. And we think that is going to be a little bit more sustainable than food parcels because we want to produce food now. Same thing with the gender-based violence. We have equipped ourselves with the people who know what is happening in that space. And our funding is going to go to mainly the organizations that deal with this matter and well guided by people who are the authority in the area of gender-based violence. I may just also say that in the process, South Africa started off with not one ventilator. We were all importing them from everywhere. Now South Africa has got more ventilators than it needs. And those have been locally produced, what we call the CPAPs or the non-invasive ventilators. This has been quite a big shift in terms of we could actually be a catalyst for local production of something that complicated. And they are easy to use. They can go to just about any level of hospital. They don't look for only specialists. They're very easy to use. People are in short of oxygen right now. And those ventilators are absolutely useful. High care equipment is actually going to Gauteng, Eastern Cape, Western Cape. Right now we're in the second wave, and that high care equipment is still going to these hospitals, even though we didn't anticipate it to be as strong as it is now. But those things have been more legacy issues now. And
I'm sure there will be cause for more discussion with you, as you say, as we go into the second wave, which will no doubt present new problems and equations to resolve. Thank you so much, Gloria Serobe, Board Chair of the Solidarity Fund.